Welcome to Royal Berkshire Hospital. My name is Parash Shah and I am one of the associate specialists in Urology department. Today I am going to talk about prostate school clinic. We are doing this since last 2 to 3 years, and that is for those patients who are having robotic assisted radical prostatectomy for prostate cancer treatment. Robotic assisted radical prostatectomy is means that the whole prostate and there is a small cystic organ behind the prostate called seminal vesicle. Everything we remove in radical prostatectomy, and that is with the assistance of robot. Actually, the whole surgery is done by the surgeon, but the robot assists in the operation. Now, this is a minimal access surgery, and previously we used to do this operation with big incision in the tummy from top to bottom, but instead of that, now in robotic prostatectomy we put 6 small incision, 3 on one side of the tummy and 2 on the other side of the tummy and 1 above the belly button. So that's how we put 6 incision. This all incision we start with about a centimeter size, and when we finish the whole operation, then for removal of the whole prostate, we have to extend one of the incision, and that will be the one above the belly button, and that will be about 3 to 4 centimeter size. So after operation, the one main incision you will see is the one above the belly button. The rest of the incision remains very small, and probably after 6 months or so you might see the one scar that will be one above the belly button. The rest of the scar will be very tiny, so you might not be able to see those scars. Now, as I said that this is a minimal access surgery, so we are doing this so that your recovery is much faster, and your stay in the hospital will be only 24 to 48 hours. You are spending less time under anesthesia, and you will be back to normal life very soon after operation. Now, robotic surgery is a teamwork, and it involves lots of people in your care when you will be admitted for the operation. So a lot of people, including medical team and pathology team, ward team, theatre team. So all of them will be looking after you during the stay in the hospital. Today's prostate school clinic, we basically do it so that you have more idea about what to look out in the pre-operative time, how we do the operation with the robot help, and also to inform you about post-operative care. Now, during the prostatectomy operation, in operation theatre, on one side of the room there will be a console of the robot where the surgeon sits. The viewing area from that console is basically a 3D view with high definition camera. Whatever the surgeon does with the hand, that all signals transmit through the robot into the tummy, and that's how the instrument moves. Now, the instruments are attached with the robotic arms, and robot has got 5 arms. We put 6 incisions, so 1 extra incision is for the assistant to help during the operation. Out of 5 arms, one of the arm we use it with the camera which goes through the belly button, while the rest of the instrument attached with the other arms of the robot. And the robot basically stands in the middle of the legs. In the operation theatre, the patient's position is lying flat with the head looking towards top part, and the head will be lower and the legs will be on the upper side. Both legs will be separated and the robot goes in between the legs, and that's how the robot is positioned in the operation theatre. Previously, when we used to do the open operation, in open operation you are doing with your hands, and that hands can move only at 180 degree, while the robotic instrument goes 360 degrees. So that way technically it's much easier and faster to do the operation. The view from this high definition area is much better than even the open operation. So that way technically this operation evolved quite a lot in last 10 to 15 years. When we used to do open operation, a lot of complication used to happen, but now with robotic operation, it's much less, as the view is better. You can save all the nerves around the prostate, and that way chance of the complications are much less than what it used to be in the open operation. Now let's talk about some pre-operative time, what we usually advise for the diet point of view. Before operation, we recommend you to have high carbohydrate diet, and also you will need high energy drink, which you don't have to buy, but when you see pre-operative nurse, that's where you will get the full box of energy drink, and they will also inform you what time you need to take those drinks as well. And after operation, you don't need carbohydrate diet, you don't need high energy drinks, but after operation you will need more of the protein and vitamin rich diet for healing point of view. And we recommend that if you are eating chicken, fish and meat, which are really high in protein, and also fresh fruit and vegetable, which is higher in the vitamin, that will be helpful for healing point of view. Also, if you are vegetarian, then probably beans and lentils and some soy based protein, that will be helpful for you to consume more. Otherwise you can have normal diet, but if you can add those things, that will be helpful for the healing. Most of the patients who come to the prostate school clinic, usually they have date for operation. So once you get the date of operation, we recommend that the evening before operation you should have light diet. Light diet is in the form of either some soup or sandwich or scrambled egg, something like that, but you should have light diet so that when you come for operation next day, your bowel is not that much distended, so you don't come on the way where the surgeon operates in the pelvis. You can have food up to the midnight, but after midnight you shouldn't have any food, and also fluid which you can have up to 2 o'clock in the morning if you are awake. Otherwise, if you are going to sleep around midnight, then please don't have anything after that till you come back for the operation, and that will be around 6 to 6:30 in the morning to Hopkins ward. That is the only urology ward in this hospital, and that's where you are coming before operation. When you come to the hospital in the morning, you first come to the Hopkins ward, and that's where you will see the nurse who looks after all the preoperative patients. They will ask you to change from your normal clothes to the gown which we provide you. Then they will start taking your blood pressure, pulse, and also they will give you the phosphate enema, because we want your lower part of the bowel to be empty as well. So that's what happens. So that is the reason we are calling you so early in the morning. Also, we advise you to bring all your regular medication, whatever you are taking, to the hospital, so that when you see anesthetist, they will go through all your regular medication, and in case if they need to give you some high blood pressure tablet or anything, they can easily give you with some sips of water. Also, we recommend you not to shave your tummy, because it's proven that if you have done that a few days or a week earlier before operation, then chance of developing wound infection is much higher. So please do not do any shaving on your tummy. We will do it just before starting the operation. Once the basic checkup done by the nurses, then the anesthetic consultant will come and see you, and they will discuss all about the anesthesia. So just for your information, you will have general as well as spinal anesthetic. That's the reason that the anesthetist would like to go through all your medical history again. And if you have any question regarding anesthesia, please do ask them. But if you are happy and the anesthetist is happy with all your history and medication, then the surgical consultant will come and see you. And if you have any question, then they are happy to answer that. But then if you are happy and the consultant is happy, then they will sign the consent form, and then you are ready for the operation. So the nursing staff in the ward will take you to the operation theatre, where first you will go to the anesthetic room, and that's where you are going to spend about 35 to 40 minutes in there. In anesthetic room, you will first have intravenous cannula so that they can start use some fluids, and after that you will have spinal anesthetic, and following that they will give you general anesthetic. So that all process together it will take around 40 minutes, and following that you will be in the operation theatre, where actual surgical time will be around 1.5 to 2 hours. And once the operation is finished, then you will be in the recovery room, where you will spend another 1.5 to 2 hours, and that is where you will regain consciousness. You will have plenty of pain control in the recovery as well, in the form of morphine based medications. If in the recovery room, if you are comfortable and you don't have any pain issue, then you can have fluid as well orally. Because we have not done operation on your bowel, we don't have any problem in starting oral fluid. So if you are thirsty, please ask the recovery nurses, and they can make tea for you, tea or coffee, whatever you need, or water. And if you tolerate fluid, and if pain is not the issue, then the nursing staff will get you back to the Hopkins ward. That's where you will be staying after operation as well. Once you are in the ward, then if your wife, partner or relative want to contact you, they can always give the number to the nursing staff in the ward, and they can give you a call, so that they can let your partner or wife know that how the operation went, and that way they can be reassured as well. Now, while you are in the recovery room, you will see few tubes coming out through the body, so please don't get surprised. You will have in one of the arm you will have intravenous cannula, where through which we will give you intravenous fluid. Even though you are already having oral fluids, still we will give you some intravenous fluid, and that is because you haven't had anything to eat or drink since midnight, and also you have lost some fluid and blood during the operation. So to recover that, we usually give some extra support for first 4 to 6 hours while you are in the ward. You will also see a couple of small tiny cannulas, tiny tubes in the nose, and that is to give you oxygen, and that is also for just 4 to 6 hours after operation, and that is the time we think that your general anesthetic medication will wash off from your body. And also there will be one drain which is coming out through the incision which we have used for operation, and that drain is connected with the bag outside, and that is basically to any fluid or blood collected around the operation site will come out through that drain. And next day, when you are starting to walk around the ward, and if there is not much coming out into the drain bag, then the nurse in the ward will take it out. So up to now, whatever tubes I told you will come out before going home. The only tube you are going home with is a catheter, which is staying in the body for 10 to 14 days after operation, and that is very important that it stays in the body, because over that catheter we have joined the water pipe and bladder, and that is giving protection for that joining, because that will keep the urine away from the joining area. And also you will notice that there is two tiny membranes around the both calf, and that is called floatron boots, and that we provide you till you get more mobile, and that is helping to prevent any clot in the leg and lungs. And that floatron boots is attached with the automatic pump, so you will notice that these floatron boots are automatically pumping your calf every few seconds, and this is a very important factor to prevent DVT and pulmonary embolism. From now on, I am going to tell you total 3 factors to prevent clot in the leg and lungs, and that one of the factor is the floatron boots, and the second factor is the mobilization, which I am going to talk in a second. And apart from that, while in the recovery, as I said, you will have some good pain control in the form of morphine. In this operation we are not cutting muscles, but we are just separating the muscles to put all the robotic instrument. That's why after this operation, for first day you might notice some pain, but from next day onwards I think you will have more of the discomfort rather than pain. So that's why you will need some simple pain control like paracetamol and ibuprofen, which I suggest that you should keep it some supply at home. So in case if you have some discomfort from wound or catheter, you can easily control it with some simple analgesia. So the second factor to prevent clot in the leg and lungs is the mobilization. We strongly recommend after this operation that you should motivate yourself to mobilize. Usually a lot of people think that they had major operations, so I'm not going to move for next day or so, but no, in 24 to 48 hours you will be back home. So that's why what we recommend that after 4 to 6 hours of operation you should at least make an attempt to come out of the bed and sit in the chair. You will have plenty of help in the ward. There is a lot of nurses and healthcare assistant who can help whenever you need. So please call them, and whenever you are ready to come out of the bed, and at least sit in the chair. While you are sitting in the chair, if there is no issue with the pain and you are comfortable, then after a couple of hours again you try and stand up and then walk around the bed or come out up to the toilet with the help of nurses. So that way as you start walking around, then your blood flow will come easily back to the heart, and that way you can avoid chance of developing clot in the leg and lungs. Now before you do that, always make sure you inform the nurses that you are intending to start walking, so that way we can detach the automatic pump from the Flotron boots. Because the automatic pump is very heavy, you cannot lift it and walk around, it has to be detached. So please let the nurses know, and then they can detach it, and then with the help of the nurses you can walk around as well. So that is very important. From next day onwards you can have wash in the ward, and then when you go home you can have shower as well. Even though you have got wounds, you have got catheter, we will teach you how to look after those while you are having shower as well. So apart from what I am telling you, still most of the things will be repeated in the ward, and the nurses will tell you exactly what to look out for. As I said that you can have shower at home as well when you reach home, but we strongly recommend not to have bath. Shower is absolutely fine, but bath is not good for first 3 to 4 weeks. Because while you are keeping your body under the water, then the stitches can dissolve faster and your wound can open it up. So please do not have bath, but shower is absolutely fine. Also, when you are in the hospital, if you want to bring your comfy clothes, then you are allowed to do so. But we recommend you to wear it next day, because on first day you might have some stains on your tummy, which can make your clothes dirty. So instead of wearing on the same day, the next day you can wear your comfy clothes. Otherwise the hospital gown will be there. After operation, we recommend that eating should be back to normal, but drinking point of view, we strongly recommend you to have plenty of fluids orally. We recommend that you should have at least 2 to 3 liters of fluid every day for next 2 to 3 weeks. If you go below 1.5 to 2 liters, then you can get dehydrated, and above 3 to 4 liters your body salts will get diluted and you can get dizzy. So that's why we recommend that 2 to 3 liter will be ideal. And what we say that if you can drink 1 glass every half an hour to an hour, that will be ideal. Now you need this much amount of fluid because you have got catheter which has got very tiny eye at the end, which is draining all the urine from the bladder. So that tiny opening can get blocked with either small clot or debris. So that's why you want to regularly flush that catheter, and that's why you need lots of fluid. Also, if you are taking good amount of fluid, then that will reduce the chance of developing constipation as well, because it's very well known that after this type of operation, because you had general anesthetic medication and the pain control in the form of morphine, which all can cause constipation. So by drinking more water, that will help to reduce the chance of developing constipation as well. As I said before in the presentation, that your stay in the hospital will be around 24 to 48 hours. So you should start making plan that who is going to drop you and who is going to pick you up, because I don't want you guys to get stressed while you are in the hospital. So from dropping point of view, you will be coming to the hospital between 6 to 6:30 in the morning, and most of the people usually go home at 48 hours. What we have noticed up to now, that about 5 to 10% people usually go even on the next day, late afternoon or early part of the evening. But don't rush. We say that if you are pain free and if you are very much confident with looking after catheter, and with physiotherapist, if you can do steps up and down, then you can even go on the next day, late afternoon or evening. But otherwise, I suggest that if you are even not comfortable enough next day, then just go at 48 hours. When you go home, as I said, you should keep some simple pain control at home in the form of paracetamol or ibuprofen type of simple medication. But we will provide you some laxatives to take home for 1 week, and that will help to reduce chance of straining while emptying your bowel, because if you are going to strain, then that will affect your core muscles, and that is what we don't want it for first week or so. So that's why please take some laxatives. And also you will give you the prescription of low molecular weight heparin, that is the injection to thin your blood, and this is the third factor to reduce chance of developing clot in the leg and lungs. Now this injection, you need 1 injection a day for next 28 days after operation. So 4 weeks you need this injection, and we will give you full box of that 28 injection, and along with that we will give you a sharp box as well. So whenever you need to give this injection yourself, and it should be in the tummy, different part of the tummies, but you cannot give this injection into the arm or leg, because if you give this injection in arm or leg, then the medication will go directly into the muscle, and the absorption of this medication is very erratic. And we want this medication to go in anywhere in the fat area, and everyone has got a little bit fat in the tummy. So this injection needs to go into the different part of the tummy. In this presentation, the injection, whatever injection is shown, is quite large. Actually, the whole syringe is very small, as well as the needle is very tiny. Like a lot of people, diabetic people, give insulin injection, it's that type of needle. So it's very small needle, and I know it's easy for me to say, but most of the people usually manage to do themselves. So what you need to do is just to hold the fold of the tummy and then give this injection directly into the tummy. So that needle is so small that it can go only just below the skin into the fat area, so that the absorption of this medication will be uniform throughout the day. Because this medication has got 24-hour action, that's why it needs to be, go into this subcutaneous area. You need to make sure that the injection you are giving should be at least 1.5 to 2 centimeter away from the wound. Wounds are very small, so you can give in different part of the tummy. If you are giving on one side one day, then they just change to the other side, go up and down, whichever way you are okay with. And then every time whenever you give injection, you might develop small bruise. So don't worry, that will all go away within next few weeks. And also just need to make sure that whenever you give your injection, once you finish it, just put it into the sharp box, and once you finish all 28 injection, the sharp box needs to go to the GP surgery, which they can destroy it for you. Also, you need to keep in mind that if you are really needle phobic, then we can ask your wife or partner to learn that, but most of the people usually are happy to give themselves. And if you or your wife or partner cannot learn that, then we can always organize practice nurse to give you this injection. But to daily go to the practice nurse with the catheter and everything, it will be more problematic for you, but we can always arrange according to what your need is. So as I said before as well, that when we used to do open operation, you have usually full cut from top to bottom in the tummy, but instead of that, now you will have 6 small incision with the 5 very tiny, while the one will be around 3 to 4 centimeter. Those incision we either stitch with the dissolvable stitches, or we can put the metal clips. This is all surgeon's choice, but both has got same healing time. If we do the dissolvable stitches, then we put some glue on the top as well. So in case if you see some sticky stuff on your tummy, that's the glue, and that will wash off when you start taking shower. While the metal clips, if we use metal clips, then that will come out on the day when you come back for removal of catheter, and that will be at 10 to 14 days. Now with this wound you can have some discomfort, and that's why as I said before, please take paracetamol or ibuprofen if you need to be, but otherwise most of the people are quite comfortable in the post-operative time when you go home. Also you will have support of the district nurses in the community when you go back home. We recommend that you should contact your GP before coming for the operation, and if you try to get the number to contact for district nurse, that will be helpful in the post-operative time. So in case if you have any problem with the wound, or if you have any problem with the catheter, then always first point of contact will be district nurse. So if you have numbers handy, then it will be easier and faster for you to contact them. They will come to your home and review your wound if there is a problem, or if there is a problem with the catheter, they can sort it out there and then. If there is any problem with the wound or catheter which district nurse cannot sort it out, then the next point of contact should be Hopkins ward. We cover mainly the Royal Berkshire Hospital area as well as Wexham Park area. So if the patients are from Wexham Park area, still we strongly recommend you that if the district nurse cannot sort it out at home, then please contact straight back to the Hopkins ward. The number of that ward will be written on your discharge letter. So whenever you feel that the problem is not getting sorted at home, then please contact Hopkins ward, and the nurse or doctor will be there for 24 hours all 7 days. So we can easily sort out these problems in our hospital because we are regularly dealing with this. If you haven't seen the catheter, there are two ends. One end where you can see the tiny black dot, and that part is staying inside the bladder, which is draining all the urine. So you can see how small opening it is. This opening can easily blocked by either debris or small clots. So that's the reason that I was stressing more fluid orally to drink for next few weeks. Also there is a balloon attached just near that opening, and that is filled with water, and we fill it through the openings outside. You can see there are two openings on the catheter, and one of the opening is to inflate the balloon, and when we need to remove the catheter, we just deflate the balloon through that opening, while the second opening by the side is to attach the bag. And that bag you can see in the picture is basically has got two plastic bands, and that is attached with the velcro, so it can go either on your thigh or on your leg. So we have got both type of leg bags available, either the longer leg bag or the shorter tubing leg bags, and that leg bag has got capacity of around 500 cc. You do need to empty this bag every 4 to 6 hours, or whenever you feel that it's getting heavy, that means the bag is getting full. So at that point you do need to go to the toilet. You open the velcro, get the bag off from the leg, and there is a small valve attached at the end of the bag, which is very easy to open and close, which will be shown in the ward how to do that. It's very easy, and I'm sure you will learn it very quickly. But basically whenever it gets full, you go to the toilet, open that valve, empty the bag, close the valve, dry the whole bag, and then bring it back to the leg, attach back to the leg. This is for the daytime. You can't wake up in the middle of the night to empty the bag. So for night time you will have separate bag called night bag, and along with that night bag we will provide you the plastic stand as well, so that you can just hang that night bag on the plastic stand, which goes by the side of the bed. At this point I also would like to tell you that this night bag has got 2-liter capacity, so that's why you don't need to wake up in the middle of the night to empty the bag. Also this night bag, either you can attach it where you have attached the day bag, or this bag can also go on the valve which you use for emptying the bag. Now if you are going to attach that night bag on the valve, then make sure you open the valve, otherwise there is no point. I'm sure you understand that, and that will also provide you the extra length in the of the night bag. There is another minor point you need to keep in mind that as well, that whenever you are sleeping, you need to know your sleeping pattern. If you are sleeping mostly all the night in the same position, then you can leave the night bag by the side of the bed on the plastic stand. While if you are frequently moving on the bed, then I strongly suggest that leave the bag on the bed. Otherwise you can think about it that the bag is just on the floor and you are moving all the way, then the bag will stay there on the stand while the catheter will get pulled up. So if catheter pulls, then you will wake up in the middle of the night sometimes with pain. So to prevent that, just do keep the bag on the bed if needed. You need to know that what are the problems can be possible with this catheter. So it can get blocked, as I said before, and also occasionally it just if it's stretched out, it can come out. It's usually very rare to come out because there is a balloon there. While the blockage, how will you know that? If you see, if you are drinking this much fluid, then every hourly you should be passing at least 30 to 60 ml in the bag. So for half an hour or so or 1 hour, if you don't see any drop of the urine in the bag, then straight away inform the district nurse. They will come to your home, they will come with some fluid and flush the catheter and get it unblocked. But if they can't do it, then or if they cannot unblock it, then the next point of contact is Hopkins ward. And please make sure you just come back to the Hopkins ward, because we don't want you to go to the Wexham Park Hospital or anywhere. Otherwise it will just delay the treatment. The next point is the removal of catheter, which is called trial without catheter, and that will happen at 10 to 14 days to your local hospital. So patients from the Royal Berkshire Hospital area will come back to the Hopkins ward for removal of catheter, while those from the Wexham Park area can also attend the Heatherwood Hospital. And if you are planning to go there, then please inform the nurse in the ward before discharge so that they can organize your removal of catheter at Heatherwood Hospital. Now till the catheter is in, no problem. Once the catheter comes out, everyone leaks urine, and that's where you will need pads. And we are going to talk in next presentation about urinary incontinence, and also to learn pelvic floor exercise. This is very important, and that's what we are going to do in the second presentation. When you go home, the gentle exercise like walking around the house or going up and down, if you have toilet or bathroom upstairs, then you can do it easily without much trouble. Also, if you want to make tea and doing minor work, that's absolutely fine, but we strongly recommend you shouldn't do any heavy weight lifting, or you should not drive car. Even though if you have automatic car, still we strongly recommend not to drive for at least 4 weeks after operation. And also no sports including swimming or golf or tennis or whatever you are playing, you shouldn't be doing that for 4 weeks. Walking is absolutely fine for a few yards after operation, but I would say that till the catheter comes out, you should restrict yourself. But once the catheter comes out, then gradually you can increase the time you are walking, and probably by end of 3 or 4 weeks you should be back to normal, whatever you are walking, like 1 or 2 miles, whatever you're doing. But you do it gradually, make sure that you are gradually increasing the length of walk. If you are working, then we are happy to give you a sick note, and that will be for first 2 weeks we will issue from the hospital, and next 2 to 4 weeks depend on your work, it will be provided from your GP. You shouldn't be, if your work involves heavy lifting, then I would say that not to go on work for at least 6 weeks. But if you are working mainly on the computer, then you can even start once the catheter comes out. Now with this operation we create 2 problems. One is urinary incontinence and second is erectile dysfunction. Urinary incontinence can only be improved by pelvic floor exercise, which we are going to learn in next presentation. But the second problem is the erectile dysfunction. Everyone develops erectile dysfunction after this procedure for first 6 to 8 weeks. But now that with the robotic operation, we can do the special operation called nerve sparing operation. And since we started that since last few years, chance of reversal of the erectile dysfunction is much faster. And but whatever happens, whether you are interested to bring your erection back or not interested, we strongly recommend you to start treatment after 6 to 8 weeks of operation, and that is in the form of tablets called Viagra or Cialis or Levitra. This type of medication helps to improve blood flow in the penis as well as help in regeneration of the nerves, because these nerves get damaged during the operation, so that needs regeneration, and this tablet helps with that. When you see the consultant after operation, that's where they will give you first prescription, and then will notify a GP to give you the regular prescription afterward. Lot of people usually recovers the erection, but that can sometimes take up to 6 months or a year to recover. And this slide will help you to get more informed about what we can do to help to get your erection back to normal. If the tablet doesn't work, then we have got injection to help to get the erection back to normal, and for that we will teach you how to inject yourself into the muscles of the penis. If you are not interested in getting injection, then there is a tube available which is called Muse, M-U-S-E, and that Muse tube, you can put it into the water pipe, and the drug get absorbed and you get erection. If you are not happy with any of this, or if you don't want to go on that route, then the next step is the vacuum pump. And that vacuum pump, with the help of the tablet together, a lot of people after prostatectomy use both of these together, and they are happy that they are getting erection back to normal, and also they are able to do the sexual intercourse as well. Now, the only downside of this vacuum pump is that it's self-funded. NHS doesn't give this, and you have to buy yourself, but it's just a one-off buy, and you can use regularly or even daily. If none of these things works, then the last resort is the operation in the form of penile prosthesis insertion, and if you want to go for that, then we can always refer you to the London hospital. And the last part is the follow-up, and that is very important, that you need to see the consultant at 3 to 4 weeks, and that is very important in a way that you will get the result of the operation in the form of biopsy result, and that time the consultant will tell you that the whole cancer part is gone, but very rarely microscopically, if there is some cells left over around the capsule of the prostate, you can always refer you to the oncologist for having a small dose of radiotherapy to kill the rest of the cancer cells. But otherwise, most of the people after operation gets cleared of the cancer. Also, we after that visit, we regularly start checking your PSA every 3 monthly initially, and it should go back to less than 0.006. That is what the machine gives the reading, and when the surgeon says that it's less than 0.006, that means all cancer part is gone from your body. Now, initially we will check it every 3 monthly, and afterward, if for a couple of years it remains undetectable, then we will go to 6 monthly check and ultimately yearly check. Also, you should have number for clinical nurse specialists, so if you have any question regarding operation or aftercare, please give them a call, and they are happy to give you answer back and also resolve all your problems. Also, in the community you will have district nurse support, and we will also provide you some support group information. If you want to join, you are welcome to do so, because a lot of people with the prostate cancer having different type of treatment, they come to the support group, and you can always discuss the different part of the treatment and your experience as well. And as a doctor and nurses, we go for the lecture there as well, so that will be helpful for you. Thank you.
Hello, I'm Karen, and I'm going to tell you about the pelvic floor exercises. I'm going to tell you why the exercises are important, where the pelvic floor is, and how to do them. Before the operation, all the men can think about is the cancer. After the operation, they're thinking about how to get their life back, whatever that is. Post-operatively, after the operation, you have the catheter removed and everybody will leak. After removal of the catheter, most men will leak. About 5% of men won't leak because of the success of the operation and the advances in surgery, but most men will leak urine and need pads temporarily. These problems usually improve in 1 to 3 months. There is a risk that they last longer. They're caused by the surgical damage and inflammation. The pelvic floor, you'll see a slide, acts as a sling supporting the bladder and the bowel. And when you do the exercises, we teach you how to do an exercise with your back passage, and you might have wondered why would we do this, but it actually, because it's a sling, it all helps pull the muscles together. So it's important that we start to do these exercises before the operation. It can actually take about 4 months to get the exercises to work to their best. We advise you to use the exercise information sheet that should be given to you. If you haven't given to it, you can get it from the Prostate Cancer UK. The website is displayed, and we advise you to set time aside to do these exercises and make them part of your regular routine. Now we need to know how to do the exercises. There's 2 parts of the exercises. You need to tighten and lift the back passage muscles that you would use to stop yourself passing wind. Most people know what that's like. It's passing wind, or if you had diarrhea and you need to lift up, clench and hold. That's the group of muscles that we're using for the exercise there. And we get you to do the front passage muscles at the same time. This is more difficult to locate, but if you try to stop yourself passing urine, that's what we want you to do. It's a lift up and clench. Now we recommend that you can try this once and once only while you're actually passing urine in the toilet. And why we only say do it once only is because it can cause backtrack to the kidneys and cause kidney damage. And this is quite clearly laid out in the information sheet. Now ideally we want you to do the 2 exercises together. If you struggle with finding the urinary muscles, just concentrate on the back passage muscles. This will do the job entirely, but it's gold standard to do the 2 together. So lift up and clench and hold, and count for a hold of 5 seconds initially. We say 5 seconds initially, building up to 10 seconds as you get more confident. But initially your body, it's such a strange exercise, your body's not used to it, and it will fatigue and the muscle will just relax, and so you've lost your strength in your exercise there. So quality is better than quantity. So you're not David Beckham, we're not going for gold, so we want to do them in the positions that we recommend. We want you to do 3 lying down, you don't need the pillow that's shown. You want 3 sitting, which is quite comfortably with your hands on your knees, and 3 standing. Now, a good way to check, because you're a man, is if you stand naked in front of the mirror, you'll see the base of your penis and scrotum move if you're doing the exercises properly. So we'll have a practice now of those exercises. We want you to put your hands on your knees, okay, and lift and your back passage muscle in and up, and your front passage muscle in and up, and we'll count 1 and 2 and 3 and 4 and 5 and relax. You can use a technique like I did there, 1 and 2 and 3, or 1 fat elephant, 2 fat elephants, a second hand on your watch or a timer on your phone, something that helps you. Talking about phones, there is an app named Squeezy that actually will talk you through these exercises and has a metronome to count you down, if that is useful for you. So we wanted to see how often we need to do these exercises. We do these exercises in 3 positions 3 times a day. So morning, noon and night, the 3 lying down, 3 sitting and 3 standing. So if you think about it, you can do 3 laying in the bed before you get up, 3 sitting by the edge of the bed and 3 standing by the bed. Then they're done. They don't take too long. After lunch, again, while you're recuperating, you can do the same again, and then at night time before you go to sleep. So we recommend that you make these part of your routine as part for life. You will always have a potential weakness there, and so it's a good job just to do them a couple of times a week, just to remind your body even if you're better, just because of the potential weakness. When you've got the hang of these exercises, we encourage you to do another set of exercises called the knack, which are the same exercises, but you just squeeze your muscles for just 1 second and let go. You can do 10 short, sharp, fast lifts, and you can do these exercises after the exercises or when you're doing something that you routinely do, like wash your hands, put the kettle on to make a cup of tea, or when you're at the traffic lights. Just something that reminds you just to squeeze, squeeze, squeeze. You can do it in the supermarket queue, nobody can see you doing it, but these exercises are particularly useful for what we call stress incontinence. If you go to cough or sneeze, you could lose control of your bladder, so they're quite useful. Pads is the next topic of conversation. You can get these in the large chemists, such as Boots in the sensitive bladder section, or supermarkets have a bigger buying power. They're a bit cheaper sometimes, and they do their own brands. The internet is a big source as well. Be careful, you don't want to buy in bulk. You don't want 1,000 pads if you're going to be dry in a month. So you be careful with that. Pads usually cost about £5 a packet, and you will on average need 5 to 6 pads a day. You will need them overnight. Pads are better used with briefs rather than boxer pants, and the Prostate Cancer UK support would be able to provide you with some trial pads for free, hopefully through the internet there, or if you've come up to prostate school in clinic. Help is available, so when you come to clinic you will be asked about incontinence and erections, so please leave your embarrassment at the door. The more you're open with us, the more we can help you. Thank you.